Avenue Medical Center, a doctor is preparing for battle against an unseen and deadly enemy. Like a warrior, she dons layers of protective gear. Uncomfortable, but a necessary shield against the coronavirus. The government hospital in Quezon City is already at capacity with COVID-19 patients. This woman is showing signs of infection. She gets wheeled into the COVID ward from the emergency room. Dr. Paulo Madela tells us his colleagues are also getting sick.
It's very difficult when a colleague of mine would test positive because we have to adjust the schedule of the whole department. It's possible that I would be taking care of 20 patients today. On the next day, I would be taking care of 40 patients.
Like most healthcare workers, hardly does he see his family. Dr. Madela takes on a 36-hour shift for 7 days straight before going on a break. He gets a week off and then it's back to work again. He says every time he'd step inside the hospital, he finds himself walking the extra mile for his patients. They're also alone and away from their loved ones. He gives them food and takes the time to strike a conversation, hoping to ease their loneliness in these difficult times.
An 80-year-old female patient, gutom na gutom siya. And then she was looking for her son. As a doctor, usually, I would console her lang. I remembered my lola. And then, pinakain ko siya and then pinainom ko ng meds. Just like what a normal person or an apo would do to his lola.
Dr. Madela says the healing process doesn't end at prescribing medicine. It's about extending kindness and care. But with all the attendant risks, sacrifices, and fatigue, the most difficult still is delivering the bad news.
The patient is a chronic kidney disease patient. At the time, it was very hard for me to explain to the daughter that his father is dying.
While the hospital recorded a number of deaths in the past 2 months, it is now beginning to see more recoveries. Patients who survive give satisfaction to doctors and nurses.
Being a doctor during these times is very fulfilling. No amount of joy can describe when a patient initially admitted with a bad prognosis, was then later intubated, is awake, oriented, and discharge stable.
There are also other sources of motivation that give them that second wind in a seemingly thankless job. Smiles from co-workers, donations, prayers, and any show of support in their continuing effort to save lives. Carolyn Bonquin, CNN Philippines.